Colon cancer, also known as colorectal cancer, is one of the most common types of cancer worldwide, affecting millions of people each year. Despite its prevalence, many individuals remain unaware of its dangers, particularly because the disease often progresses silently in its early stages. Colon cancer can develop without noticeable symptoms, making it difficult to detect until it has advanced to a more serious stage. This hidden nature poses a significant threat to individuals, as early detection is key to successful treatment and improved survival rates. The absence of obvious symptoms can lead people to mistakenly believe they are not at risk, especially if they feel healthy or do not have a family history of the disease. However, colon cancer can affect anyone, and relying solely on the presence of symptoms can delay diagnosis. Regular screenings and increased awareness are essential in preventing the disease or catching it early. In this video, we will explore how colon cancer can go undetected, the importance of understanding the risk factors, and the role of screening in identifying the disease before it becomes life-threatening. By being informed, individuals can take proactive steps toward protecting their health and minimizing their risk of colon cancer. Before we continue, I've noticed that my content isn't reaching as many of you as it used to. You can help change that by engaging with this video. Please like, comment, and share it with friends who might find it interesting. Now let's get back to it. Colon cancer, or colorectal cancer, originates in the colon or rectum, which are parts of the large intestine and the digestive system. Most colon cancers begin as small benign clumps of cells called polyps, which form on the inner lining of the colon or rectum. Over time, some of these polyps can become cancerous, invading the surrounding tissue and potentially spreading to other parts of the body. The transformation of a benign polyp into malignant cancer can take several years, making early detection and removal of polyps critical in preventing the development of colon cancer. There are several types of colon cancer, but the most common is adenocarcinoma, which accounts for about 95% of all colorectal cancers. Adenocarcinomas begin in the mucus-producing cells that line the colon and rectum. Other less common types of colorectal cancer include carcinoid tumors, gastrointestinal stromal tumors, GISCTs, lymphomas, and sarcomas, each originating from different types of cells within the colon. Various factors contribute to the risk of developing colon cancer. Age is one of the most significant, with the majority of cases occurring in individuals over the age of 50. However, the disease is not exclusive to older adults, as more cases are being reported in younger populations. Family history also plays a critical role, with a person's risk increasing if a close relative has had colon cancer or certain genetic syndromes such as Lynch syndrome or familial adenomatous polyposis, FAP, which significantly raise the risk of colorectal cancer. The development of colon cancer is a gradual process that often begins with non-cancerous polyps. These polyps may remain harmless for years, but in some cases, they undergo genetic changes that cause them to become malignant. When this occurs, the cancerous cells grow uncontrollably, potentially spreading to nearby tissues and other parts of the body through the lymphatic system or bloodstream. This process, known as metastasis, makes colon cancer much more difficult to treat once it has progressed beyond the colon or rectum. One of the most dangerous aspects of colon cancer is its ability to develop without causing noticeable symptoms. In its early stages, colon cancer often remains asymptomatic, meaning that affected individuals may feel completely healthy and unaware of the presence of the disease. This silent progression allows the cancer to grow and spread undetected, making it much harder to treat once symptoms do appear. Many people expect that serious illnesses like cancer will come with obvious warning signs such as severe pain or sudden changes in health. However, early-stage colon cancer often produces few, if any, symptoms. The lack of noticeable changes in bowel habits or overall health can lead people to falsely believe that they are not at risk, even if the disease is silently progressing inside their body. Some conditions may present mild symptoms similar to those of colon cancer, such as irritable bowel syndrome, IBS, or hemorrhoids, leading individuals to misattribute changes in their digestive health to less serious conditions. This misinterpretation can delay diagnosis and allow the cancer to continue developing unnoticed. For example, rectal bleeding is often mistaken for hemorrhoids, which are common and generally not life-threatening, leading many to delay seeking medical advice. In some cases, colon cancer is discovered incidentally during routine medical tests or screenings for unrelated issues. For example, a person undergoing a colonoscopy for a different reason, such as screening for polyps, may unexpectedly discover the presence of early-stage cancer. This underscores the importance of regular screenings, as colon cancer can be present in the body for years without causing any symptoms. Screening allows doctors to detect and remove polyps before they become cancerous, or to catch cancer at an early stage when it is easier to treat. While colon cancer can be asymptomatic in its early stages, there are several symptoms that may arise as the disease progresses. Unfortunately, these symptoms are often subtle or mistaken for less serious conditions, leading many people to ignore them until the cancer has advanced. Recognizing these warning signs is crucial for early detection and treatment. One common symptom of colon cancer is unexplained weight loss. Many individuals may lose weight without making any changes to their diet or exercise routine, attributing the weight loss to stress or other factors. However, unexplained weight loss can be a sign that something more serious is happening in the body. As colon cancer grows, it can interfere with the body's ability to absorb nutrients, leading to unintentional weight loss. Changes in bowel habits, such as diarrhea or constipation, can also be a sign of colon cancer. While occasional changes in bowel movements are normal, persistent changes that last for more than a few days may indicate a problem. Some individuals may experience a narrowing of the stool, which could signal that a tumor is partially blocking the colon. Others may notice alternating periods of diarrhea and constipation, which can occur as the tumor affects the normal flow of waste through the intestines. Fatigue and anemia are other symptoms that can be linked to colon cancer. As the cancer grows, it can cause slow chronic blood loss in the colon, leading to a decrease in red blood cells and, ultimately, anemia. This can result in feelings of extreme tiredness or weakness, even after a full night's rest. Many individuals may dismiss this fatigue as a result of a busy lifestyle or aging, but persistent fatigue should not be ignored, particularly if it is accompanied by other symptoms. Persistent abdominal pain or discomfort is another symptom that may be overlooked. Some individuals with colon cancer may experience cramping, bloating, or a feeling of fullness even after eating small amounts of food. This discomfort can be caused by a growing tumor that is obstructing the colon or affecting nearby organs. Because occasional abdominal pain is common and can be caused by a variety of factors, many people may dismiss this symptom as a minor issue. It is important to recognize that these symptoms, while often subtle or easily ignored, can be signs of colon cancer. If any of these symptoms persist for more than a few days or become more severe over time, it is important to seek medical attention. Early diagnosis can greatly improve the chances of successful treatment and long-term survival. Given that colon cancer often develops without obvious symptoms, screening plays a vital role in detecting the disease at an early stage. Screening allows doctors to identify and remove precancerous polyps before they have a chance to turn into cancer, or to catch cancer in its earliest stages when treatment is most effective. Several screening methods are available for detecting colon cancer, each with its own advantages and limitations. The most common and effective screening tool is a colonoscopy, which involves inserting a flexible tube with a camera into the rectum to examine the inside of the colon. During a colonoscopy, doctors can not only detect polyps or cancer, but also remove any polyps that are found, preventing them from becoming cancerous. Colonoscopy is highly effective, but some individuals may be reluctant to undergo the procedure due to its invasive nature. For those who are uncomfortable with a colonoscopy or unable to undergo the procedure, other screening options are available. The fecal occult blood test, FOBT, is a non-invasive screening tool that checks for hidden blood in the stool, which can be a sign of colon cancer. While the FOBT is less invasive than a colonoscopy, it is also less accurate and may miss small polyps or early-stage cancers. Another option is the fecal immunochemical test, AFIT, which is similar to the FOBT, but more accurate in detecting blood in the stool. Screening guidelines for colon cancer vary based on an individual's age and risk factors. For most people, regular screening is recommended starting at age 45, with colonoscopy typically repeated every 10 years if no abnormalities are found. However, individuals with a family history of colon cancer, genetic predispositions, or other risk factors may need to begin screening earlier and more frequently. It is important to discuss with a healthcare provider when and how often screening should be done based on personal risk factors. Despite increased awareness about colon cancer, many misconceptions persist about who is at risk and how the disease develops. These misunderstandings can lead to delayed diagnosis and missed opportunities for prevention and early detection. One of the most common misconceptions is that colon cancer only affects older people. While age is a significant risk factor, with most cases occurring in individuals over the age of 50, colon cancer can and does affect younger people as well. In fact, recent studies have shown a rise in the incidence of colon cancer in people under 50, a trend that has baffled researchers and prompted new recommendations for earlier screening. Younger individuals who develop colon cancer may not recognize the symptoms or may dismiss them as minor issues, leading to delays in diagnosis and treatment. Another myth is that maintaining a healthy lifestyle guarantees protection from colon cancer. While a balanced diet, regular exercise, and avoiding smoking and excessive alcohol consumption can reduce the risk of developing colon cancer, they do not eliminate the risk entirely. Even individuals who lead healthy lifestyles can develop colon cancer, especially if they have other risk factors such as family history or genetic predispositions. It is important to recognize that no one is immune to colon cancer, regardless of their lifestyle choices. Many people also believe that colon cancer will always present with obvious signs or symptoms, such as severe pain or bleeding. As discussed earlier, colon cancer can be asymptomatic in its early stages, making it difficult to detect without screening. Relying on symptoms to signal the presence of colon cancer can be a dangerous approach, as by the time symptoms do appear, the cancer may have already progressed to a more advanced stage. Regular screening is essential for detecting the disease early before symptoms arise. Colon cancer is a serious and potentially life-threatening disease that often progresses without noticeable symptoms, particularly in its early stages. This silent progression makes it all the more important for individuals to be proactive about their health by understanding the risk factors, recognizing subtle symptoms, and undergoing regular screenings. While age, family history, and genetic predispositions play a significant role in colon cancer risk, lifestyle factors such as diet, exercise, smoking, and alcohol consumption also contribute to the likelihood of developing the disease. By adopting healthy lifestyle habits, staying informed about the symptoms and risk factors of colon cancer, and adhering to recommended screening guidelines, individuals can significantly reduce their risk and improve their chances of early detection. Colon cancer can be treated successfully if caught early, so it is important not to ignore warning signs or delay screening. Awareness and education are key to preventing colon cancer from becoming a silent killer. By taking control of their health, and staying vigilant about potential symptoms, individuals can protect themselves from this dangerous disease and ensure a healthier future.